everyone, welcome to December 2025 Medicare Minute. Today, we're going to be discussing medical identity theft. My name is Allison Dahl, and I am your SHIP Manager, the State Health Insurance Assistant Program here at Baltimore County Department of Aging. We are located at the Bicota Senior Center in room 321, and our phone number is 410-887-2059. And if you'd like to reach us by email, feel free to do so by contacting us at medicareinformation@baltimorecounty.md.gov. The SHIP office is here to help you navigate the Medicare Cs by providing free, unbiased, and confidential information, counseling, and assistance to Medicare beneficiaries, their family, and caregivers to help them make informed decisions about their health insurance options. All right. So let's dive in and understand medical identity theft. What is medical identity theft? Well, this is when someone fraudulently gets and uses your personal and medical information to get treatment, equipment, or prescriptions. And why does it matter? Well, every time a scammer uses your information, it creates a record with incorrect medical information about you. This could affect when you receive treatments, if you can get your medications, and it might even cause for a creation of a bill that you didn't even know about. This could potentially leave you with unpaid bills or medical debt, and that can really affect your credit. So let's learn how we can protect ourselves from medical identity theft. Well, the first thing you want to do is be careful who you give your prescription information to. This includes your Medicare number, your Social Security number, if you give your credit cards out, or even your driver's license number. This information should really be protected. And even though you trust your friends and family, it might be best not to share it with them because they're not always working in your best interest. I know it's hard to believe, but it's something to take into consideration. You want to make sure you never give out your Medicare number to anyone who calls, texts, or emails you unexpectedly. It's really important to remember that Medicare and Social Security will never reach out to you and ask for your personal information. That information is just for you to keep safe to yourself. If someone does call you and they say that they're from Medicare or Social Security Administration and they need your information, it's most likely a scammer. You want to make sure you hang up and report that incident immediately. You also want to keep documents that contain your medical information somewhere safe, including your insurance card, your insurance enrollment forms, your prescription bottles, and billing statements, as all of these have personal identification information about you, and you want to keep that safe. So let's talk about the signs of medical identity theft. Well, charges on your Medicare statement for services, equipments, or medications you didn't receive and didn't need, those might be a sign of medical theft. You may have received a shipment of braces, testing kits, or other medical supplies in the mail that you actually didn't request. If you are contacted by a debt collector company for providing a bill you didn't owe or something you didn't know that you owed, credit report shows an unknown charge on a medical debt, or Medicare and or a Medicare Advantage plan denies you because they're saying that you've already reached limits for something that maybe you didn't even request assistance for yet, that could be a sign that you are a victim of medical identity theft. So how do you respond and report to medical identity theft? If you believe someone has stolen and is using your medical information, contact your local senior Medicare patrol or SMP. Your SMP will encourage you to do the following things. 1. Review your Medicare statement. Look at any services, items, or prescriptions you did not receive or any providers that you did not recognize. Get copies of medical records. Explain the situation to your healthcare providers and request that they send you all of your records. Report errors or mistakes that you find in your medical records to health professionals. Review your credit card reports. Look for medical billing errors. This includes medical debt collection notices that you do not recognize. And report your compromising Social Security number if you gave it out to Social Security Administration. Lastly, it's important that you take action. Contact your senior Medicare patrol if you believe medical identity has been compromised. Contact Social Security Administration if you gave your Social Security number out. Also, you can make a recovery plan at www.identitytheft.org. This will help you keep organized and make sure that you are on track with regaining your medical identity. You can also visit the www.annualcreditorreport.com or call 877-322-8228 to get your free credit card report and look if any medical billing errors are there. That's a great place to start. After that, contact your state health insurance program if you have any questions about your Medicare coverage. And that is how you can keep your medical identity safe and make sure you do not fall into the hands of any theft. Thank you guys, and we'll see you next month for our next Medicare Minute.